Hello, I am Seong-kyung-hoon, the big elephant of Seoul 21st Century Hospital. I hope everyone has been doing well. The weather has gotten quite cold recently. You can see ice on the streets, and it's the season where elderly people need to be careful not to slip on the ice and fracture their spine. Last time, while talking about various treatment methods, I recommended to my patients that procedures are one of the good treatments. However, when it goes beyond the stage of procedures and cannot be treated with them, we resort to what is commonly known as surgery. There are also many types of surgical methods, aren't there? Endoscopy, microscopy, or, although it's not a very good expression, screws. There are surgeries that people refer to as inserting metal rods. There are often questions about which surgery is good and which is bad, or not in general, because each of these surgeries has its own purpose. I cannot definitively say what is good or bad. However, these days, it seems that people understand endoscopic surgery as a cure-all or a very safe method, and there are quite a few doctors who explain it that way. The biggest advantage of endoscopic surgery is usually that you can be treated quickly and go home soon. They emphasize these aspects, but what's important is not that, but whether the disease is properly cured. I think the more important factor is how safely the surgery can be conducted. What I am holding in my hand right now are the instruments used for endoscopic surgery, and using this tube, the endoscope enters our body. While observing through the endoscope, we cut what needs to be cut, remove what needs to be removed, and widen what is narrowed. These are the types of surgeries that are currently popular as endoscopic surgeries. However, when endoscopic surgery initially started, it was not performed from the backside. It is a surgery that enters from the side of the waist, the side part of the back. In other words, the main purpose was to remove the disc. When removing the disc in this way, the common complication of nerve adhesion, which is the biggest complication for patients who have undergone surgery, rarely occurs. However, by inserting such a tube into the muscles of the back, an effective endoscopic surgery that uses an endoscope, such as the two-way endoscopic surgery that is talked about these days, or single-port endoscopic surgery, these types of surgeries inevitably have to deal with adhesions. It means that there is a high possibility of fewer adhesions forming. The statement that there are no adhesions is a very incorrect expression and a misunderstanding. Is adhesion a problem? It can be a problem, or it might not be. Although it sounds a bit strange, there are patients who feel the effects of adhesions. There are also patients who do not feel adhesion symptoms, so it must be considered on a case-by-case basis. However, such endoscopic surgeries are usually performed alone. In surgeries that are typically performed alone, there often isn't someone beside you to correct or adjust any mistakes. In surgeries like microscopic surgery or other types, multiple people are involved in the operating room during the procedure, discussing and talking about the lesions together while performing the surgery. But since endoscopic surgery is performed alone, there's a tendency to make decisions and handle everything on one's own without discussions or anything like that. Since it is done alone, it can be said that the possibility of errors occurring might be slightly higher compared to other surgeries. While it is true that endoscopic surgery has its advantages, one should not think of it as a cure-all. I believe it is indeed right to perform surgery selectively in very narrow cases. This is Seong-kyung-hoon from Seoul 21st Century Hospital. I emphasize to you once again, endoscopic surgery is certainly a good surgery. However, one should not think that endoscopic surgery can solve everything. Endoscopic surgery is a method that can be used for selected people in a narrow area. So thinking that endoscopic surgery can solve everything can be a significant mistake. Patients, please don't be too dazzled by endoscopic surgery. This has been Seong-kyung-hoon, the big elephant from Seoul 21st Century Hospital. Thank you. Please subscribe, like, and set notifications.